Did you know that every 40 seconds, someone in the US has a heart attack? That's over 700,000 heart attacks every year. While we often think of diet, stress, and lack of exercise as risk factors, what if I told you that some of the medications you take daily could be quietly increasing your risk, without you even realizing it? From common pain relievers and antidepressants to diabetes medications and heartburn drugs, studies have linked certain medications to a higher chance of heart attacks, strokes, and other cardiovascular issues. In today's video, we're breaking down 8 medications that could be silently harming your heart, and more importantly, what you can do to protect yourself. Stick around because we're also going to talk about safer alternatives you can discuss with your doctor. Your health is in your hands, let's dive in. Number 1, NSAIDs, common painkillers. Painkillers like Ibuprofen, Advil, Motrin, Naproxen, Aleve, diclofenac, and Celecoxib, Celebrex, are widely used to relieve pain, inflammation, and fever. They seem harmless since they're available over the counter, but what many don't realize is that even short-term use can significantly increase heart attack risk. A 2017 study published in the British Medical Journal, BMJ, found that taking NSAIDs for as little as 1 week could raise the risk of a heart attack by 20 to 50%, depending on the dosage. The reason? These medications affect prostaglandins, hormone-like substances that help regulate blood vessel function. By altering these pathways, NSAIDs can cause fluid retention, high blood pressure, and constriction of the arteries, putting extra strain on the heart. Over time, this increases the likelihood of blood clots, strokes, and heart attacks, especially in people with high blood pressure, a history of heart disease, or kidney problems. But even if you don't have existing heart conditions, frequent or long-term use can still be risky. So, what are the safer alternatives? If you need pain relief, acetaminophen, Tylenol, is generally considered a safer option for the heart. You can also turn to natural anti-inflammatory remedies like turmeric, ginger, and omega-3 fatty acids, which help reduce inflammation without the cardiovascular risks. For chronic pain, physical therapy, hot/cold therapy, and gentle movement exercises can be effective, too. No matter what, it's always best to use the lowest possible dose for the shortest time needed to minimize risk. If you rely on NSAIDs frequently, talk to your doctor about safer options. Your heart will thank you. Number 2, antidepressants. Antidepressants like fluoxetine, Prozac, sertraline, Zoloft, escitalopram, Lexapro, venlafaxine, Effexor, and duloxetine, Cymbalta, are widely prescribed to help manage depression and anxiety. While these medications can be life-changing for many, they may also come with hidden risks for your heart. A 2018 study published in JAMA Psychiatry found that selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs, could lead to abnormal heart rhythms, increased blood pressure, and a higher risk of blood clot formation. One of the main concerns is that these medications can reduce platelet aggregation, meaning the blood doesn't clot as effectively. While this might sound beneficial in some cases, it can actually increase the risk of bleeding-related complications, including hemorrhagic strokes, especially in individuals already at risk. If you have high blood pressure, a history of heart attacks, or previous strokes, you may need to be extra cautious when taking these medications. Older adults are particularly vulnerable due to age-related changes in cardiovascular function. However, this doesn't mean that you should stop taking antidepressants without consulting your doctor. Abrupt withdrawal can lead to serious side effects and mood instability. If you're looking for safer alternatives, cognitive behavioral therapy, CBT, has been shown to be an effective drug-free approach for managing depression and anxiety. Regular exercise is another powerful option, as it naturally boosts serotonin levels while also improving heart health. If you and your doctor decide to transition off antidepressants, gradual tapering under medical supervision is essential to avoid withdrawal symptoms and maintain mental well-being. Your heart and your mental health are both important. Find the right balance for you. Number 3. Calcium channel blockers. Calcium channel blockers, CCBs, such as amlodipine, Norvasc, diltiazem, cardizem, and verapamil, are commonly prescribed to treat high blood pressure, angina, chest pain, and certain heart rhythm disorders. They work by relaxing and widening blood vessels, which reduces the workload on the heart. While this may seem beneficial, not all CCBs are created equal, and some carry significant cardiovascular risks. A study published in Circulation found that short-acting CCBs were associated with a 25% increased risk of heart attacks in some patients. The reason? While these medications lower blood pressure, they can also cause fluid retention, worsen existing heart failure, and lead to irregular heart rhythms, arrhythmias. This can be especially dangerous for individuals who already have low blood pressure, heart disease, or a history of heart failure. High doses or long-term use can put added strain on the heart, making it harder for it to function properly. If you're taking a calcium channel blocker, it's important to monitor symptoms like swelling in the legs, dizziness, or an irregular heartbeat, as these may indicate a developing issue. If you're concerned about the risks, safer alternatives include ACE inhibitors, such as lisinopril, or beta blockers, such as metoprolol, which provide blood pressure control without the same level of cardiovascular risk. As always, before making any medication changes, consult your doctor to discuss the best treatment plan for your specific needs. Your heart health should never be compromised. Number 4. Diabetes medications. For people managing type 2 diabetes, medications like rosiglitazone, Avandia, were once widely prescribed to help regulate blood sugar. However, research has shown that some of these drugs can come with serious risks, especially for your heart. A 2007 study published in the New England Journal of Medicine, NEJM, found that rosiglitazone increased the risk of heart attacks by 43% and cardiovascular death by 64%. These alarming numbers led the FDA to restrict its use in 2010, though some limitations were later lifted. So, what makes rosiglitazone so dangerous? The problem lies in how it affects fluid balance in the body, leading to fluid retention, high blood pressure, and extra strain on the heart. Over time, this can worsen heart failure and significantly increase the risk of life-threatening cardiac events, particularly in people who already have heart disease, high blood pressure, or a history of heart failure. If you're taking a diabetes medication, it's important to know that safer alternatives exist. Metformin is a widely used first-line treatment that has been shown to improve blood sugar control without increasing heart risks. Additionally, SGLT2 inhibitors and GLP-1 receptor agonists have demonstrated protective effects on the heart while also helping to manage diabetes effectively. Beyond medications, lifestyle changes such as a healthy diet, regular exercise, and weight management can play a huge role in controlling blood sugar naturally while supporting heart health. If you have concerns about your diabetes medication, talk to your doctor about safer options. Your heart depends on it. Number 5. Decongestants. When you're battling a stuffy nose from a cold, allergies, or sinus congestion, decongestants like pseudoephedrine, Sudafed, and phenylephrine may seem like an easy fix. These medications work by constricting blood vessels in the nasal passages, helping to reduce swelling and clear congestion. However, the problem is that they don't just affect your nasal blood vessels, they can also impact your heart and circulatory system in ways you might not expect. Decongestants are known to significantly raise blood pressure and increase heart rate, which can put stress on your cardiovascular system. In some cases, they can trigger irregular heart rhythms, arrhythmias, palpitations, and even chest pain. For people who already have high blood pressure, heart disease, or a history of stroke, these effects can be particularly dangerous. The risks become even greater when combined with caffeine, smoking, or other medications that affect blood pressure. This combination can overload the heart and increase the chance of serious cardiovascular events. So, what can you do if you need congestion relief but want to protect your heart? Fortunately, safer alternatives exist. Instead of decongestants, try steam inhalation, which naturally opens up nasal passages, or use saline nasal sprays to flush out mucus without side effects. If allergies are contributing to your congestion, antihistamines can help reduce symptoms without the cardiovascular risks. If you're unsure whether a medication is safe for you, always consult your doctor. Your heart health comes first. Number 6. Chemotherapy drugs. Chemotherapy drugs like doxorubicin, adriamycin, and fluorouracil, 5-FU, are essential for treating many types of cancer, but they can also come with serious risks for heart health. While their primary job is to target and destroy cancer cells, these powerful drugs can also damage heart tissue, sometimes leading to long-term cardiovascular complications. A study published in JACC Cardio-Oncology found that doxorubicin can cause heart failure in up to 26% of patients, particularly when used in high doses or over extended periods. This drug generates free radicals, which can damage heart muscle cells, leading to scarring and reduced heart function. Similarly, fluorouracil, 5-FU, has been linked to coronary artery spasms, which can restrict blood flow to the heart and potentially trigger heart attacks. People undergoing chemotherapy, especially those with pre-existing heart conditions, high blood pressure, or a history of heart disease, should be closely monitored for signs of heart strain, shortness of breath, chest pain, or irregular heartbeats. However, there are steps to minimize these risks. Oncologists often recommend regular heart function monitoring, including echocardiograms, to detect early signs of damage. Additionally, medications like dexrazoxane can help protect the heart from chemotherapy-induced damage. If you or a loved one is undergoing chemotherapy, talk to your doctor about heart-friendly strategies to reduce cardiovascular risks. Taking a proactive approach can help protect your heart while you fight cancer, because both your heart and your health matter. Number 7. Testosterone and anabolic steroids. Testosterone therapy and anabolic steroids are often used to boost muscle growth, increase energy levels, and improve athletic performance. While they may offer benefits, especially for individuals with low testosterone, they also come with serious heart risks that many people don't realize. A 2017 study published in JAMA Internal Medicine found that men who started testosterone therapy had a 30% higher risk of heart attacks and strokes within just 3 months. The problem? Testosterone and anabolic steroids can thicken the blood, making it more likely to clot. This raises the risk of high blood pressure, heart attacks, and strokes. Additionally, they can lower HDL, good cholesterol, while raising LDL, bad cholesterol, contributing to artery blockages. Over time, steroid use can also enlarge the heart muscle, leading to conditions like left ventricular hypertrophy, which makes it harder for the heart to pump blood efficiently. Anyone considering testosterone therapy should be cautious, especially those with a history of heart disease, high blood pressure, or blood clot risks. For bodybuilders or athletes using anabolic steroids, the long-term consequences can be even more severe, with studies linking their abuse to sudden cardiac death, even in young users. If you want to naturally boost testosterone and improve strength without the risks, focus on strength training, quality sleep, and consuming healthy fats like avocados, nuts, and olive oil. These lifestyle changes can support hormone balance while keeping your heart strong and healthy, because a strong body means nothing without a healthy heart. Number 8. Heartburn medications. Heartburn medications like proton pump inhibitors, PPIs, including omeprazole, Prilosec, and esomeprazole, Nexium, are among the most commonly used treatments for acid reflux, GERD, and stomach ulcers. They work by blocking stomach acid production, which provides relief from heartburn. But what if these medications were also quietly increasing your risk of a heart attack? A Stanford University study analyzing medical records from over 3 million people found that those taking PPIs had a 16 to 21% higher risk of heart attacks, even if they had no prior history of heart disease. One possible explanation is that PPIs reduce nitric oxide production, which is crucial for keeping blood vessels flexible and open. Without enough nitric oxide, arteries can become stiff, raising blood pressure and increasing the likelihood of blood clots, key contributors to heart attacks and strokes. Additionally, long-term PPI use has been linked to magnesium deficiencies, which can lead to irregular heart rhythms, arrhythmias, muscle weakness, and even sudden cardiac events. If you suffer from chronic acid reflux, there are safer alternatives to consider. H2 blockers like famotidine, Pepcid, work differently and may pose fewer cardiovascular risks. Additionally, making dietary changes, such as avoiding spicy foods, caffeine, and large meals before bed, can help manage acid reflux naturally. Probiotics and digestive enzymes can also promote better gut health, reducing the need for acid-suppressing drugs. If you've been taking PPIs for an extended period, talk to your doctor about safer, heart-friendly options, because managing heartburn shouldn't come at the cost of your heart health. Your health is in your hands, and being informed about the hidden risks of common medications can make all the difference. From painkillers and antidepressants to diabetes drugs and heartburn medications, some prescriptions and over-the-counter drugs can increase your risk of heart attacks, strokes, and other cardiovascular issues. But the good news is that safer alternatives exist, and small changes can protect your heart without sacrificing your health. If you're taking any of these medications, talk to your doctor about your risk factors and alternative options. In addition, heart-healthy lifestyle changes, such as regular exercise, a balanced diet, stress management, and avoiding smoking, can significantly reduce your risk. If you found this information helpful, give this video a thumbs up, share it with others, and subscribe for more health tips. Stay informed, stay healthy, and take care.